what does hospice cover? Hospice is covered 100% by Medicare, so the financial burden is not on the family or the patient. It's 100% covered by Medicare. What is covered, equipment is covered, any equipment. You don't, it's beds, it's wheelchairs, walkers, bedside commodes, transfer benches, any equipment that the patient might need or the family might need to help care for the patient in the home. Medication associated with the diagnosis that we would be taking care of the patient for, and any supplies. Some hospice companies are a little different than others. We cover, like, Depends for our patients. The sponges to wet their mouths. As their life journey gets closer to the end, a lot of dehydration happens, so the sponges are there to moisten their mouths and that sort of stuff. We cover all of that. Some hospice companies don't, our company does. We also cover things like Miralax that for constipation and that sort of stuff. We cover those things, comfort, things to make them more comfortable. Hospice is supportive, not curative. So if it were a cancer patient, we couldn't do hospice care and chemotherapy radiation. So you can't be looking for a cure and aggressive treatment and have hospice care at the same time. We do provide comfort and support, not just for the patient, but for the family. So home health and hospice is different. Home health is there to make the patient better. So they're solely for the patient, and if they have goals they have to meet for the patient to get better. Hospice is there for the patient, the family, and we're there to make them comfortable. We're there to keep them comfortable and to be there as comfort measures and support. We have a team. It's a team approach. So it's an RN case manager, it's a CNA, it's volunteers, it's a social worker, a chaplain, a bereavement coordinator, volunteers, clinical directors, medical directors. It's a whole team approach that we care for the patient and for the family. We have medical directors. You can choose, the family can choose to keep the patient's doctor as the medical director, as the attending physician, or you can choose to use the hospice medical director. So you have choices with hospice. The good part about using a hospice medical director is that medical director is accessible 24 hours a day, 7 days a week. So if you need something in the middle of the night, a medication or something like that, or a question answered, those medical directors have to be accessible. And so you have physicians readily available to you.
Do you have both?
No, you have to have one or the other, because it's associated, of course, Medicare directs billing. So somebody's signing off on the orders, and so it has to be one or the other.